When the word menopause is brought up or said, most people think about women and the life change that they go through in their midlife. If men talk about menopause, it's more than a joking matter. Oh, what's wrong? You're going through menopause, you sissy? You'll be alright. Well, male menopause is a real thing that real men go through at some part of their life. Whether it's now, later, just for a couple months, for a couple years, it is something that they suffer and something that they go through. The major points that I'm going to talk about to try to convince you or to show you that male menopause is a real thing that men suffer from is what male menopause is, the cause and how it's diagnosed, the symptoms that the men go through and how those symptoms affect the men, and the treatment options that's out there so the men can get treatments for male menopause. Well, for me to persuade you or to show you that it's real, first you got to know what male menopause is. Well, McCree says that male menopause refers to a hormonal change that men go through as they age. Well, Body Logic MD says that a more politically correct term would be andropause, because to go through menopause you have to have a menstrual cycle that you will no longer have after menopause. Well, men don't have menstrual cycle, only women do. So that's why they say andropause is a more politically correct term, because they could go through it, get it fixed, and have to go through it again. The cause for andropause just isn't one thing. Medical News Today says that there's several factors that could cause male menopause or andropause. It could be high blood pressure, high blood sugar, or low testosterone, or some other medical condition. How to diagnose andropause is kind of tricky. So everyone says that after the age of 30, males' testosterone levels decrease 1% per year. Well, to get diagnosed, you would have to go to your doctor. First thing they're going to do is a physical exam to make sure that the man's heart's still pumping, his liver's still working, his spleen, his pancreas, everything on the inside is working good. The next thing they're going to do is they're going to sit you down or sit the male down and go over a questionnaire with them to ask them questions to see if they're having symptoms of andropause, or the questions that they're asking them, it could be for some other medical conditions. The next thing they're going to do is they're going to want to run more tests to rule out heart disease, high blood pressure, high blood sugars, or any other condition that it could be. They can also run a blood test to test the testosterone levels in the males. And then they can do a bone density test to see if the man is losing some of their bone density. Because testosterone is the main hormone for males, like estrogen is the main hormone for females. So now that we know what it is and how it's diagnosed and what causes it, now we can talk about the symptoms and the effects that those symptoms have on the men. Well, the major symptom, or the number one symptoms that the men suffer from with andropause, is low testosterone. Men's Health says that Men's Health said that low testosterone can have several different effects on the men, from erectile dysfunction, reduced sexual desire, fewer or less spontaneous erections, or infertility. Well, some men want to have kids, and if they got kids, if they want kids, another symptom that can lead into it with them being infertile is depression. Depression is also another symptom that can come along with andropause. Yesevich says that the lower the testosterone level, the more severe that the depression is for the male. Another symptom that men can suffer from with andropause is physical changes, from increase in body fat, muscle, or well, muscle loss or strength, they're not as strong. They can also have less bone density. They can be weak. They could be more weak and more tired. They can also affect their sleep patterns, that they can have insomnia, because testosterone plays a role in aiding in how men sleep. So now that we know some of the major side effects and how they affect men, now we can talk about the treatments for those side effects or those symptoms. The first thing that they can do, WebMD says that to treat low testosterone, WebMD says that you can do testosterone replacement therapy. Those can help relieve some of the symptoms, the replacement therapy. It can help decrease the low libido. The way that they can do this, or the way that the men can do these treatments, the therapy treatments, is through skin patches, which they would just put on their skin, and they get transdermal. They would get the medicine through that. You can get it on your back, your stomach. They do the capsules that the men would take twice a day. Take 2 capsules twice a day, in the morning and the evening. There is the gels that they can put on their arms or under their underarms, and then there's the injections that the men can get from their doctors. Just a shot that they can get. Now, the risk with the therapy replacement, the hormone therapy replacement, is if you got people that has prostate cancer that runs in their family, or breast cancer for the males, it can increase your chances of getting those. Or if you already have those, it can cause complications with treatment or just with the cancers themselves. Another treatment that they can help for one of the symptoms is the antidepressants. Some of the major antidepressants that a doctor might prescribe for the men is Cymbalta, Lexapro, Prozac, Remeron, and Zoloft, are just some of the major names that people know that men could get help and get treated for with that antidepressant. To help with the physical changes that men go through, Medicine Net says that a certain lifestyle change could help, from a new diet to exercise to even going to the gym or an exercise program. Going up, getting moving could help raise you not being as tired and weak. Another thing that they can get treatment for is the insomnia, and some of the major pills that doctors prescribe for men, for the men for the insomnia, are Lunesta, Ambien, Sonata, and Restoric. There's just some of the major, but not only sleep aids that they can get. Well, I've talked about what andropause or male menopause is, how it affects the men, what causes it. I've talked about the symptoms that they can have, from low testosterone to depression to all these things, and then the treatments that they can get, from the injections to the pills to the change in exercise. So all this is to show that if the men, my suggestion to you is, if the men are, or you men, or any of the women that know men, if you are, or they are, or you know someone that is suffering from this, to get help. This isn't something to be ashamed of. This is something that men go through. The awareness for it needs to be increased, because this is a real thing that men go through. And I hope that watching this speech or this video, that they realize that this is something that they go through. Don't think that it will pass or it will get better, because it won't. You need help from a medical professional to get help to make the symptoms, or to relieve some of the symptoms, to get better. That this is something that men can get help for, that they can treat and become better with.